In the setting of healthcare reform and its associated challenges of implementation, physicians have a unique perspective and interest in bringing medical expertise to the business of medicine. An administrative role for a physician is generally a good fit for those who fundamentally understand the physician-patient relationship and who also understand operations and strategy. By nature of the profession, all physicians are leaders, and many have particularly strong leadership skills. As physicians, we deal with ambiguity and make difficult decisions on a daily basis. It is not uncommon for physicians in general and gastroenterologists in particular to consider, or more often, to be asked to serve in an administrative role. Some of these roles are on a volunteer basis and others are paid positions. These roles may include, in the practice setting, being a partner, a managing partner, an office medical director or research director, a board member, an executive committee member, a director of quality and safety, and president or an officer of the practice. In the ambulatory surgery center, one may serve as a medical director, a chair of quality assessment, performance improvement, a chair of the medical executive committee, or as a board member. Lastly, in the hospital or health system setting, one may serve as a director of the endoscopy unit or service line, chief of the gastroenterology service or service line or department, chair of the Department of Internal Medicine, vice president of medical affairs, or chief medical officer, or even serving in a governance role on the board of trustees of the hospital or health system. The challenge when moving into an administrative role is changing your focus from individual patients to the health system or the organization as a whole. And here, there are a few issues to consider when contemplating taking on an administrative role. Your authority should match your responsibility. You should balance your role as an administrator with that of a clinician if you elect to continue some clinical duties. And lastly, the degree to which the rank and file will accept the need for leadership and you as their leader should also be taken into account. You should take stock of your interest in an administrative role and also your own personal skill set prior to deciding which leadership position to pursue. Identify weaknesses in your skill set and consider pursuing formal or informal education and training to overcome these weaknesses. Some of these important skills include effective communication, effective interpersonal skills, the ability to persuade, motivate, and influence others, skills in financial management, and lastly, skills in personal management and emotional intelligence. In conclusion, there are several administrative opportunities in gastroenterology. Whether you practice in academia or the private practice arena, consider your professional goals and your present and future skill set to help you select an appropriate role to pursue.